An alleged case of a clinical officer being infected by coronavirus after coming into contact with a patient. And to have this discussion with us is none other than the chairperson of the Kenya Union of Clinical Officers, he is Peter Wachira, talking to us here on a KTN News Center. I believe you can see him on your screens right now. Mr. Wachira, thank you so much and good morning. So is the government aware of this case? Because the spokesperson yesterday, could not confirm or deny the alleged case of a clinical officer being infected.
Yeah, thanks for having me, Brenda. Again, I'm Peter Wachira. I'm the National Chairman for Kenya Union of Clinical Officers. The government does not have to accept or have knowledge of this for it to be real. It's not an alleged case. It's my colleague from Nairobi County who has been infected in line of duty. She hadn't traveled. She contracted coronavirus while carrying out her normal duties. And she's currently in isolation. As the Union for Kenya Clinical Officers, who have the mandate to ensure protection of our members, we can confirm this.
All right, so Mr. Wachira, what proof do you have that the clinical officer, the lady, was infected by corona, has been infected? Is that the COVID-19, does she have the COVID-19 symptoms?
So what happened is that she had seen a suspect. And then, after some time, she developed some signs and symptoms, and it's actually herself who thought it prudent to actually take herself to be tested. And she actually tested positive, and that is how now she was admitted.
All right,
and so for the evidence, she has already been tested, and she is now in isolation. And I think really what we should be talking about is how we can be able to avoid this.
All right, and it's good you're saying that there is proof that the test of the nurse came out positive. So after realizing that she came into contact with a patient who has coronavirus and the test turning out to be positive, did she attend to any other patients?
Yeah, after coming into contact with the suspect, because it was not a confirmed case, she saw the case and then she referred the case to Mbagathi, but she didn't get to know later whether this case was positive. So for some days, she actually continued to see patients and to interact, of course, with her colleagues, and that is why the colleagues are now in quarantine, and the facility for now had actually been closed for disinfection.
So how many of her colleagues are on quarantine?
I may not know the specific numbers per now, because we also have even the subordinate staff, but what I know is that the colleagues in that facility for now, they are on quarantine, which is very good, and what should actually happen so that we do not continue maybe infecting our patients, because when then you are the clinician who is seeing these patients, and then you be infected and probably for a period and you don't even know, then there is a possibility that you can be able to infect the patients you are seeing, and that will mean, because the patients who are coming to you, they are already sick, so their immunity is low. So actually, the rate of the infection rate or the probability of infecting them will be very high. And
right,
of course,
so yes. Mr. Wachira, allow me to cut you short. Then it means for the nurse, for the clinical officer, for the clinical officer to be infected by corona because of a patient that she was attending to, then it means it begs the question rather about the protective gears and the sort of plans the government has put in place. So are you satisfied, when it comes to how the government is handling the welfare of health professionals in the country?
Yeah, of course, we are not satisfied, and we are saying that we can be able to do better. Number one, for clinical officers who are frontline, and let me maybe give a picture to Kenyans as to why we are coming out as clinical officers, and we are feeling that there must be tangible measures put in place to give us confidence, is because when you come to that facility, you'll be triaged by a nurse, maybe for 2 minutes in open air. But then because of confidentiality, I'll have to be in an enclosed room with you for about 15 minutes. And it's only after now talking with you that I will be able to diagnose and say this person is having an infectious disease. And that is why we are saying we must treat every outpatient in this country as a high-risk area. So when it comes to preparedness, in most of the counties, clinic officers who are the first line and who are supposed to be the people really looking out for these people and referring them where they do not follow the guidelines to call before they come, 90% of them have not been trained.
All right, so
most of the facilities have a severe shortage of these protective mechanisms.
All right, so as we bring this conversation to an end, Mr. Ashira, yesterday I had your press briefing and you're saying that you will not take part in terms of this fight against COVID. And yet it is a disease that, an infection that every Kenyan needs to own it. That is the statement from Mutahi Kagwe, the CS for Health. So if you decide to pull out of this fight, then how are we going to win, the fight against COVID-19 as a country?
Yeah, what we are saying as a union is that we are not pulling out. And let Kenyans know that we are not pulling out. But what we have said is that we are no longer going to wait for the government, because I think this is a new thing and probably everybody is being caught unawares, is that, number one, we are coming together as unions to form an operation center where we'll be getting these shortfalls across the country from the ground. Number two, we are going to propose tangible solutions and we are going to ourselves follow them through. Number three, we have advised our members countrywide, every morning when you come to the facility, you must sit together as the whole team, as all cadres, and assess your protective measures in place to protect you during that day. And number four, we must have a separate area where we will be able to see people with these signs and symptoms, and it must be well marked that if you are coming from outside and you're having signs and symptoms, if you have been in contact in the country with somebody suspected or confirmed with COVID, or if you have the signs and symptoms of COVID, there will be a tent that will be clearly marked so that you don't interact with the others, and we'll have a clinician who will now be having the protective mechanisms. And when we do not have the protective mechanisms, then that tent will be closed and we will refer you to another facility.
All right. Thank you so much, Mr. Peter Wachira, the chairperson of the Kenya Union of Clinical Officers, just raising very pertinent questions. We are yet to hear from the government today whether they already know, that case of a clinical officer who was infected by coronavirus, who was infected by coronavirus after attending to a patient. It is a developing story right there. We'll continue giving you more updates. Now, away from that interview with Ms.